What's going on, everybody? It's Mason. This is going to be the first episode of the It's Anatomy Time Bootcamp for Anat Phys 1. So it's going to be the first video on the channel. So thank you, everybody, coming over here and supporting if you came from TikTok or Instagram. And yeah, this video is just going to be the first of many of kind of a all-encompassing course of what's going to be covered in Anat Phys 1. So yeah, I hope you guys enjoy this, and let's get into the video. Alright, so the first topic today is going to be terminology for anatomy and physiology. Some of the terminology we're going to be covering is directional, regional, planes, abdominal pelvic, and cavities. So let's get into it. So the first part of terminology we're going to be looking at is directional terminology. So we'll be talking about superior versus inferior, anterior versus posterior, medial versus lateral, proximal versus distal, and superficial versus deep. So this diagram here is just kind of showing us how all these terms can be applied to the directional terminology of the body. So on this one on the left here, we can see anterior is referring to something on the front part of the body, whereas posterior is going to be referring to something on the back part of the body. And on this other diagram, we can see first superior and inferior. Superior is going to be something on the upper part of the body, and inferior is going to be something on the lower part of the body. Next, we see medial and lateral. This just means that anything close to the midline, so like the imaginary midline of the body here, that is going to be medial, whereas something further from that midline is going to be lateral. And finally, we have proximal and distal. Proximal and distal are going to be applied to the limbs. So when we're talking about either the lower limbs or the upper limbs. So proximal is going to be something that is closer to the origin of that limb, and distal is going to be something that is further from that origin. So as well as just like being able to identify like parts or like areas in relation to the body, you use these terms to compare certain body parts to each other. So for example, you would say the head is superior to the feet. You can see the head is above the feet. And then you could say the, let's see here, try to find a good example. The latissimus dorsi, which is like the main muscle of the back, is posterior to the chest. So we can see the chest is on the front half and the back is on the posterior half. And then another example for proximal versus distal, the bicep muscle is proximal to the wrist. You can see the bicep is closer to the origin of the limb as opposed to the wrist. And finally, medial versus lateral, you could say that the nose, which isn't on this diagram, but you can imagine the nose is medial to the ear. The nose is closer to the midline than is the ear. Next, we're going to be talking about regional terminology, and as you can see here, there's a large amount of terms when it comes to regional terminology, so I'm not going to read through all these right now. I will just show them to you on a diagram, and there's actually even more on this next slide here. So yeah, let's get into that. So first, cephalic and cranial is just going to be referring to the head in whole. Cervical is going to be referring to the neck. Acromial is going to be kind of the lateral part of the shoulder right here. Axillary is referring to the armpit. Pectoral is referring to the chest. Sternal is referring to your sternum, which is kind of medial to the chest right about here. Antecubital is going to be the anterior portion of your elbow. So you have your elbow, which is like on the back of your arm, but antecubital is just going to be kind of the anterior version of where your elbow is. Antebrachial is going to be the forearm region, which is distal to the brachial region, which is just your arm. Thoracic is going to be referring to the thoracic cavity. So that's just going to be, sorry, the lines are getting a little out of hand here, but thoracic is just going to be like your rib cage area. Abdominal is going to be below your thoracic cavity, so that's just going to be like where your abs and where your stomach would be. Umbilical refers to the belly button, right? That's where the umbilical cord attaches, so that's going to be kind of very medial in your abdominal region. Manual is just referring to the hand as a whole. Palmar is going to be referring to the palm of the hand specifically. Coxal refers to the lateral part of the hip, so right about here where you'd feel your hip bone. Pubic is referring to the pubic region of the body, which is very medial and kind of inferior to the abdominal region. Femoral is simply referring to our thigh or our proximal leg. Patellar is going to be referring to the anterior part of our knee, so right on our kneecap. And pedal finally is going to be just referring to the foot as a whole. Now let's go over this second half, or this right side. So gluteal is just going to be referring to our glutes or our butt. Inguinal is going to be referring to kind of the crease that runs from the lateral portion of your hip to your pubic region. So kind of right this line right here. Lumbar is just going to be referring to the inferior portion of our back right here. Nuchal is going to be the posterior part of our neck, so right here. Scapular is just going to be right on our scapula, kind of lateral to the midline of the body and very superior on the back. Vertebral is just going to be our spine as a whole, so the spine runs all the way down kind of from your neck all the way down to your buttocks almost, so that whole region right on the spinal cord is going to be vertebral. Cubital is going to be the posterior part of your elbow, so just the back side of your elbow. Sacral is going to be the most inferior portion of your spine, again kind of right above your gluteal region. Digital is going to be referring to either your fingers or your toes, so both the fingers and the toes are called the digital region. Popliteal refers to the posterior part of the knee, so again patellar is the anterior part of the knee, whereas popliteal is the posterior part. Crural is just referring to the entire distal portion of the leg, so from the knee down to the foot. Tarsal is going to be referring to the ankle. Calcaneal is going to be referring to our heel specifically. And finally, plantar is simply the bottom of our foot. So plantar is like palmar for the hand, but plantar is for the foot, obviously. All right, and now the last part of this regional terminology is just going to be right on the face. So frontal is going to be referring to where the frontal bone of the skull is, which is just kind of right on our forehead. Otic is going to be referring to our ear. Nasal is going to be referring to the nose. Buccal refers to the cheeks. Oral refers to the mouth. And mental refers to the chin. All right, so next we're going to go over the anatomical planes, which are going to include the sagittal plane, the frontal or coronal plane, and the horizontal or transverse plane. So we can see the planes here on this diagram. First, the horizontal or transverse plane is going to be this plane right here that slices the body into a superior and inferior half. The frontal or coronal plane is going to be this one right here that slices the body into a posterior and an anterior, or a front and back half. And finally, the sagittal plane is just going to be this plane right here that kind of slices the body right down the midline, so it's going to make a left and right half of the body. All right, so the next terminology topic we're going to be covering is abdominal pelvic region / quadrants, and these are all the terms that we're going to be covering. For the abdominal pelvic regions, we're going to have the right and left hypochondriac region, the epigastric region, the right and left lumbar region, the umbilical region, the right and left iliac region, the hypogastric region also. And then for abdominal pelvic quadrants, which are different, but they kind of overlie the abdominal pelvic regions, which you'll see in a second, it will make a lot more sense. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So those obviously pretty easy to memorize. They're just named right based off of their positioning. So yeah, let's get into those. So first we're just going to talk about the quadrants, and you can see, like I said, they're just named right after their positioning in the abdominal pelvic region. So we have the right upper quadrant and the right upper portion of it, the left upper quadrant and the left upper portion, the right lower quadrant and the left lower quadrant. And something you might be seeing here is, oh, why is the right side on the left side and why is the left side on the right side? Well, when it comes to anatomy, we always have to think in terms of anatomical position. So when we are talking about right and left, we are talking about the right and left of this person up here, the person that we are looking at. So from this person's perspective, this is their right side. So this is the right upper quadrant and this is their left side. So that is the left upper quadrant. That's something really important that a lot of people get mixed up in anatomy and physiology, and it can become really confusing, especially when you're getting into more complex structures like the heart or the lungs or any other thing in the body. You always have to remember that the right and left, they kind of flip so that you are talking about it from the patient's perspective per se. And for the abdominal pelvic regions, again, the right and left idea kind of remains the same. We have the right hypochondriac region, which is going to be our top right region. The epigastric region, which is going to be the most superior region, also in kind of the middle of the two. and our left hypochondriac region, which is going to be our top left. So the two hypochondriac are on the top along with the epigastric, which is between them. Next, when we go down a row per se, we have the right lumbar region and the left lumbar region, and in between them we have the umbilical region. And a good way to remember this is that the umbilical is like the belly button, so you can kind of think of the umbilical region as like the midpoint right on the belly button. That's at least the way I used to memorize it. And yeah, obviously right and left lumbar, this is kind of more towards the lower back per se, so that can help you remember that this is the lumbar. And then finally, the right iliac region, the left iliac region, and the hypogastric region. So a good way to memorize this is that the bones of the pelvis, one of them is called the ilium. So the right and left iliac region are closer to the pelvis. And then hypogastric, a good way to remember epi and hypogastric is that hypo is like low. So hypogastric is lower on the body as opposed to epigastric, which epi is like higher. So yeah, that's going to be all for those. All right, so the last terminology topic that we have to cover is body cavities. And the body cavities we're going to be looking at is the cranial cavity, the vertebral cavity, the thoracic cavity, which is going to include the mediastinum, the pleural cavity, and the pericardial cavity, the abdominal cavity, and the pelvic cavity. All right, so again here we have a diagram. We're just going to kind of point these out and make sure it's clear what all of these cavities are. So the cranial cavity obviously is just going to be the head here, right? Cranial region refers to our head, so that's a good way to remember that. The vertebral cavity is just going to kind of be all the way down here. It is going to house the spinal cord. So vertebral, our spine is made up of vertebrae, so the vertebral cavity is just going to follow the vertebrae. Next, let's look at the thoracic cavity, which is probably our most complex cavity we have to be able to remember. The mediastinum is simply this orange part here that is kind of in the middle of all these other cavities. So it's important to remember these cavities are separate, but they're all a part of the larger thoracic cavity, which we can kind of see here from this lateral view. So again, the mediastinum is going to be kind of this portion between the lungs and above the heart. The pericardial cavity is just going to be around the heart, and then the pleural cavity is going to be the one that goes around the lungs. So these can definitely be a little bit difficult to memorize. One way that you can memorize the pleural cavity is that pleural, although it's spelled different, is spelled like the word plural, which means two, and we have two lungs, so you can remember that the pleural cavity contains the two lungs. And cardial, heart refers to cardiac, cardiovascular, you can remember that, and then the mediastinum is in the middle, media, medium, middle. It's a way you can memorize it. It's not like the easiest thing in the world, but sometimes little things can help. And then finally, the abdominal cavity obviously just houses the abdominal region. It has our abdominal pelvic regions in there as well. And finally, the pelvic cavity, which is also just kind of in the pelvic area. So those two are going to be pretty easy to memorize. And that is going to be it for this first video. So I just want to say thank you for watching. If you guys made it all the way through, let me know if there's anything you'd want me to change in the future with these videos. If you'd like me to talk slower or maybe like go in depth more on certain topics. I feel like for me, terminology is a pretty like cut and dry, pretty simple topic. So I kind of feel like I might have gone a little fast on this, but if I did, let me know in the comments. And yeah, just let me know if you enjoyed this kind of long form content. And yeah, make sure you stick around, watch out for the remaining videos of this course to come out. And yeah, I hope you guys learned something today. And yeah, have a great day.